Next module, ethical considerations in health IT. Ethical considerations in health information technology are paramount as the integration of technology into healthcare raises complex moral dilemmas regarding patient privacy, data security, equity, and the overarching responsibility of healthcare professionals and organizations. This module explores the key ethical principles that guide health IT practices, the challenges faced by professionals in the field, and strategies for adhering to ethical standards in health data management and technology implementation. Firstly, key ethical principles in health IT. Several fundamental ethical principles underpin practices in health IT, including autonomy, beneficence, non maleficence, justice, and confidentiality. Firstly, autonomy. Respecting patients' autonomy involves recognizing patients' rights to make informed decisions about their health care. Health IT systems should empower patients by providing access to their health information and allowing them to participate in discussions regarding their treatment. Next, beneficence. This principle emphasizes the necessity of acting in the best interests of patients. Health IT solutions should aim to improve patient outcomes and enhance the quality of care delivered. Professionals must weigh the potential benefits of technology against any risks or negative consequences. Next, non maleficence. Closely related to beneficence, the principle of non maleficence mandates that healthcare professionals avoid causing harm to patients. In the context of health IT, this requires careful consideration of data privacy, cybersecurity measures, and the potential impact of technology on patient safety. Next, justice. Ethical considerations of justice emphasize fairness in healthcare access and treatment. Health IT must ensure equitable access to technology and health information for all patients, regardless of their socioeconomic status, race, or geographic location. Next, confidentiality. Respecting the confidentiality of patient information is fundamental in healthcare. Health IT systems must ensure that sensitive health data is protected from unauthorized access and breaches, safeguarding patient privacy. Next, ethical challenges in health IT. While the principles mentioned above provide foundation for ethical practices, health IT professionals encountered several challenges in upholding these principles. Firstly, data privacy concerns, cybersecurity threats, informed consent, health equity, and use of artificial intelligence. Firstly, data privacy concerns. The digitalization of health information raises concerns about patient privacy and the potential for unauthorized access or breaches of sensitive data. Ensuring compliance with privacy regulations like HIPAA while maintaining clinical workflows can be complex. Next, cybersecurity threats. As healthcare systems increasingly rely on technology, the risk of cyber attacks and data breaches poses a significant ethical challenge. Organizations must prioritize robust security measures to protect patient data from malicious threats. Next, informed consent. Obtaining informed consent for the use of patient data in research or data analytics can be difficult. Patients may not fully understand how their data will be used, raising ethical concerns about transparency and autonomy. Next, health equity. Disparities in access to health IT can exacerbate existing inequalities in healthcare. Ethical considerations must address how to ensure all patients benefits from technological advancements, particularly marginalized communities. Next, use of artificial intelligence. The integration of AI in healthcare raises ethical questions regarding decision making process, bias, and accountability. Ensuring that AI algorithms are fair, transparent, and free from bias is critical in safeguarding patients' interests. Next, strategies for promoting ethical practices in health IT. To navigate ethical considerations effectively, health IT professionals can adapt several strategies. These include establishing a code of ethics, training and education, fostering a culture of ethics, engaging stakeholders, and regular ethical evaluations. Firstly, establishing a code of ethics. Developing a clear code of ethics specific to health IT practices can guide professionals in making ethical decisions. This code should reflect the organization's values and outline principles for data management and patient engagement. Next, training and education. Regular training on ethical principles and practices should be provided to all staff members, ensuring they understand their responsibilities in protecting patient data and upholding ethical standards. Next, fostering a culture of ethics. Creating an organizational culture that prioritizes ethical behavior encourages employees to raise concerns about ethical issues openly. Establishing mechanisms for reporting and addressing ethical dilemmas fosters transparency and accountability. Next, engaging stakeholders. Involving a diverse range of stakeholders such as patients, clinicians, IT professionals, and ethicists in discussions about ethical considerations can provide diverse perspectives and lead to more comprehensive decision making. Next, regular ethical evaluations. Organizations should conduct ongoing evaluations of their practices to assess ethical implications, particularly concerning emerging technologies and data usage. Establishing an ethics committee can provide guidance and oversight for ethical decision making. In conclusion, ethical considerations are critical in the realm of health IT, impacting how patient information is managed, shared, and utilized. By upholding essential ethical principles such as autonomy, beneficence, and non maleficence, justice, and confidentiality, health IT professionals can enhance trust and accountability in healthcare delivery. Navigating the ethical challenges inherent in technology implementation requires a commitment to continuous education, fostering a culture of ethics, and engaging stakeholders in meaningful discussions. By prioritizing ethical practices, health IT professionals not only safeguard patients' interests but also contribute positively to the advancement of the healthcare system, ensuring that technological innovations lead to improved patient care experiences and equitable outcomes. As the healthcare landscape continues to evolve with advancements in technology, professionals in health IT must remain committed to ethical practices that prioritize the well being of patients and the integrity of health information systems. Next, the role of ethics committee and boards. Within healthcare organizations, ethics committees or boards play a crucial role in guiding ethical practices in health IT. These include decision making framework, review of technology implementation, and education and advocacy. Firstly, decision making framework. Ethics committees provide a forum for discussing complex ethical dilemmas and can assist healthcare organizations in developing policies that align with both ethical standards and regulatory requirements. Next, review of technology implementation. Committees can assess the ethical implications of new technologies, such as AI algorithms in clinical decision making or telehealth solutions, ensuring that these technologies prioritize patient rights and improve care quality. Next, education and advocacy. Ethics committees also serve an educational role, advocating for staff training on ethical considerations and fostering a culture of ethical awareness within the organization. This may involve creating resources and workshops to raise awareness about emerging ethical issues. Next, the impact of cultural competence on ethics. Cultural competence is an essential aspect of ethical practices in health IT. Understanding and respecting cultural, social, and economic differences among patients is vital for providing equitable care. These include culturally sensitive data collection and patient engagement. Firstly, culturally sensitive data collection. Health IT professionals must be aware of how cultural differences can impact patients' perceptions of privacy and data sharing. Being sensitive to these differences can help address patients' concerns and foster trust. Next, patient engagement. Engaging patients from diverse backgrounds in discussions about their care and technology use helps ensure that health IT solutions meet their specific needs, thereby improving adherence and outcomes. Next, ethical implications of data use and technology. The use of data in health IT comes with specific ethical implications that professionals must navigate. These include informed consent and transparency, data ownership and rights, and ensuring fairness in algorithmic decisions. Firstly, informed consent and transparency. Ensuring that patients are fully informed about how their data will be used, shared, and protected is critical. This includes being transparent about participation in clinical research and data analytics efforts. Next, data ownership and rights. Establishing clear policies around data ownership is essential. Patients should have the right to access their health information, determine how it is used, and consent to sharing with third parties. Next, ensuring fairness in algorithmic decisions. As healthcare increasingly incorporates algorithms for decision making, it is crucial to evaluate these algorithms for fairness and bias, ensuring that technologies provide equitable outcomes for all patients is a fundamental ethical concern. Next, building ethical frameworks for emerging technologies. As technologies such as artificial intelligence, telemedicine, and big data analytics continues to grow, establishing ethical frameworks is vital. These include guidelines for AI and machine learning and regulatory compliance. Firstly, guidelines for AI and machine learning. Creating ethical guidelines for AI applications in healthcare involves ensuring that algorithms are designed and deployed in a way that is transparent, accountable, and fair to all patient demographics. Next, regulatory compliance. Staying abreast of changing regulations concerning new technologies fosters ethical practices. Compliance should be integrated with ongoing ethical assessments to ensure that innovations are aligned with patients' rights and safety. In conclusion, ethical considerations in health IT are crucial for guiding the responsible management and sharing of health information. By grounding practices in key ethical principles, health IT professionals can navigate the complexities of patient care and technology integration while prioritizing patient welfare and privacy. The commitment to ethical practices must be reinforced through ongoing education, the establishment of ethical committees, and the adoption of culturally competent approaches. As the field continues to evolve, remaining vigilant about the ethical implications of emerging technologies and practices will be vital for building trust, enhancing patient care, and ensuring compliance within the dynamic healthcare environment. By fostering a strong ethical foundation, health IT professionals can lead efforts to harness technology for the benefits of patients and the healthcare system as a whole, driving innovations that are not only effective but also equitable and just. This ethical commitment ultimately ensures that technology serves as a tool for improving health outcomes and enhancing the patient experience in a meaningful way. Thank you.